Picture this. You're basking in the sun, enjoying a picnic, when suddenly bam! A wasp flies by like it's out for revenge. You freeze, holding your breath, praying it doesn't notice you. But then it does, and boom, you're stung. Why does it hurt like you've just been slapped by the universe? Is this nature's idea of a joke? Buckle up, because we're about to explore why these buzzing troublemakers are more than just a nuisance and how to survive their wrath without turning into a crying mess. What exactly are wasps? Wasps are flying insects, and while they belong to the same family as bees and ants, called Hymenoptera, they have some distinct differences. First off, wasps are more predatory, while bees are primarily pollinators. Wasps are often sleek with smooth, shiny bodies that make them stand out from their fuzzier cousins. The main difference, however, lies in their behavior. Wasps do not collect pollen. Instead, they hunt for food, including other insects, which is why they are classified as predators. Their diet mainly consists of other insects like caterpillars, flies, and spiders. This predatory behavior helps them maintain the balance of ecosystems by controlling populations of pests. Some species, like yellow jackets and hornets, are known for being particularly aggressive, especially when they feel their nest is threatened. Unlike bees, wasps don't die after stinging, meaning they can sting you repeatedly, making them even more dangerous. Understanding what makes wasps tick is the first step in staying safe when encountering them. Why does a wasp sting hurt so much? It's no secret that a wasp sting is painful, but do you know why it hurts so much? When a wasp stings, it injects venom into your skin. The venom contains a mixture of toxins, including histamine, which triggers the pain and inflammation response. This venom causes the sharp, intense pain that you feel immediately. But that's not the end of it. A wasp's sting also releases pheromones, which act like a chemical distress signal, alerting other wasps in the area. This pheromone can attract more wasps to the site, which can turn a single sting into a multi-sting situation if you're near a nest. The venom itself is designed to disable prey, and while it does hurt humans, it's not usually fatal unless an individual is allergic to the venom. In fact, the venom serves as a defense mechanism, preventing other predators from attacking the wasp. This combination of sharp pain and the potential for multiple stings makes a wasp encounter particularly unpleasant, and one that should be handled with care. So next time you spot a wasp, give it space to avoid being the target of more than one sting. What happens to your body when you get stung? Getting stung by a wasp is never a fun experience, and it starts with a sharp, burning pain that can last anywhere from a few seconds to a few minutes. Soon after, the sting site becomes red and swollen as your immune system kicks into action, releasing histamines to battle the venom. This causes the blood vessels to dilate, leading to swelling and warmth, and you might even feel some itching or a mild rash. For most people, this reaction fades within hours. However, if you're allergic, things get more serious. Swelling in your face or throat, difficulty breathing, and a rapid heartbeat are signs of anaphylaxis. In these cases, quick medical attention is crucial. Always stay aware of how your body reacts and know when to get help. Anaphylaxis, the danger of wasp stings. Anaphylaxis is a severe, life-threatening allergic reaction that can occur after a wasp sting. Although most people only experience pain, swelling, and redness, some individuals may suffer from anaphylaxis, which occurs when the body's immune system goes into overdrive in response to the venom. The most serious symptoms include difficulty breathing due to swelling in the throat, a drop in blood pressure, dizziness, and even loss of consciousness. Anaphylaxis can escalate quickly, so it's crucial to seek medical attention immediately. If you know you're allergic to wasp stings, it's recommended to carry an epinephrine autoinjector, commonly known as an EpiPen. The EpiPen administers a dose of epinephrine, which helps reverse the symptoms of anaphylaxis and buy you time until medical professionals arrive. However, the injection is not a substitute for seeking medical help, as you still need to get to a hospital as soon as possible. People with severe allergies should also wear a medical alert bracelet to help first responders quickly assess their condition in case of an emergency. Prevention and preparedness are key to staying safe around wasps. What should you do if you're stung? If you get stung by a wasp and you're not allergic, the treatment is relatively straightforward. The first step is to clean the sting site with soap and water to prevent infection. Once the sting is clean, you can apply a cold compress or ice pack to the affected area to reduce swelling and numb the pain. Avoid scratching the sting, as this can lead to infection. For pain relief, over-the-counter painkillers such as ibuprofen or acetaminophen can help, and antihistamines can alleviate itching and swelling. If the swelling doesn't subside after a day or two, or if the pain becomes unbearable, it's important to consult a doctor. In rare cases, an infection can occur, so keeping an eye on the sting site is essential. Most people recover from a wasp sting without any complications, but if you begin to experience unusual symptoms such as increased redness, warmth, or pus, it could indicate an infection, which may require medical treatment. Don't hesitate to seek help if the symptoms feel severe, and always be cautious of any potential allergic reactions. Preventing wasp stings, tips and tricks. While it's impossible to avoid wasps completely, you can take steps to lower your risk of being stung. Start by staying calm and avoiding attracting them. Wasps love sugary food, so cover your meals and store leftovers safely. Always seal trash and dispose of scraps quickly. Never disturb a wasp nest. They're territorial and won't hesitate to defend it. If you spot a nest, call a pro for removal. Wearing light-colored clothes can help, as wasps are drawn to dark shades. Don't swat at them, this just makes them feel threatened. Keep your distance, and you'll reduce the chances of a painful encounter. Stay smart, stay safe. Interesting wasp facts. Wasps are fascinating creatures with a few surprising features that you may not know about. For instance, did you know that male wasps don't have stingers? The males, unlike females, do not need to defend the nest, and thus lack the stinging ability. However, they are not totally harmless. Males often engage in aggressive behavior by raising their hind legs and acting as if they could sting, which can be intimidating. Wasps also play a vital role in nature by controlling pest populations. Their predatory habits help reduce the number of insects that might otherwise become pests in crops or gardens. Some wasp species are also solitary, meaning they do not live in large colonies like yellow jackets or hornets. These solitary wasps will often create individual nests and lay eggs that will eventually hatch into larvae, which they feed with insects they captured. Wasps are essential for pollination as well, although they are not as effective as bees. These fascinating creatures are far more complex than most people realize. Wasp stings, not always fun, but not always dangerous. Wasp stings can be incredibly painful, but in most cases, they are not dangerous unless you're allergic to the venom. The pain typically subsides within a few hours, and the swelling usually goes down within a day or two. However, for those who are allergic, wasp stings can lead to anaphylaxis, a life-threatening condition that requires immediate medical attention. If you've been stung and are not allergic, the treatment is simple. Clean the sting, apply cold compresses, and take pain relievers as needed. Being prepared, staying calm, and avoiding the insects will go a long way in preventing stings. By understanding the behavior of wasps, the risk factors, and how to respond, you'll be better equipped to handle these flying critters. The next time you see a wasp, remember to give it space, and you'll likely avoid being stung altogether. And that's a wrap on everything you need to know about wasp stings, how to avoid them, what happens when you get stung, and how to handle it like a pro. If you found this video buzzing with helpful info, give it a thumbs up and don't forget to subscribe for more wild facts and survival tips. Stay safe, and remember, keep your distance from the stingy squad.